Hey everybody, how you doing? This is Dr. Jeffrey Wise. Super excited. I'm about to go into a procedure. We're doing a fractionated CO2 laser. I love doing the CO2 laser as either a standalone procedure for patients, but I oftentimes will use it in combination with facelifting procedures and or eyelid surgery, chin implantation, a number of procedures, even rhinoplasty. It's just such a great way to tighten up the skin. It's very, very rejuvenating. It takes away brown spots. It takes away dyschromias. It takes away fine lines and wrinkles. So it's just a great way to get kind of like new skin. It's quite deep. So for that reason, we recommend that people kind of stay out of the spotlight for probably at least about a week or so. There's some fairly significant peeling involved. But after the skin peels off, the new skin that's left behind is fantastic. It looks fantastic. The fractionated CO2 laser is that while it is relatively invasive, the results last for potentially years. And it's not something you have to do every few months to keep up with it or anything like that. It really just lasts a long time, and the results are durable, and it looks really, really terrific. How are you feeling, okay? Good. A nice demonstration. We've actually lasered half the forehead. So you can see this area here has been lasered. And you can see tiny little dots, and the skin's turning a little bit red, which is great. That's what we like to see. And of course, this is her native skin right now, which hasn't been lasered. So just want to show people the difference in the two sides. Exciting stuff. It's looking good. Love it. Skin's responding beautifully. Her entire face has been lasered, and I just wanted to demonstrate the power of this laser. And how well it treats the eyes. So I'm going to show you. You can actually watch the skin on the eyes shrink. It's actually really, really incredible because they tighten up almost immediately right on the table. It's really, really cool. You're not going to feel anything. You don't have to worry. But we're just talking here. Nothing's happening. I'm going to do one round here. There we go. And you can actually see the skin shrink. It's pretty incredible. Watch, we're gonna do it again. You can just watch it shrink. A little bit here. There we go. Watch, we're gonna do it again. You can just watch it shrink. This is just a really, really brief demonstration of how a fractionated laser works. In an unfractionated laser, the laser essentially treats every molecule of skin. So it's like almost like paint going over the skin with laser energy. A fractionated laser is a newer technology, and that technology makes tens of thousands of little dots onto the skin. And those dots are microscopic, and they have these what we call microablative columns, where we actually treat the skin, but you're not paintbrushing the skin. You're actually treating little dots in the skin. But what that does essentially, it creates a much safer experience for the patient, because it greatly reduces the risk of scarring or any complications and other things that were traditionally seen when you have a fully ablative or fully unfractionated laser. So that's really the power of this laser. And I'll demonstrate right now actually on this. This is a tongue depressor, and I'll show you guys how it works. It's pretty cool. This is our little dot here, and I'm gonna laser my tongue depressor. So here we go. 1, 2, 3. If you see that, I'll demonstrate. So when we do a fractionated CO2 laser, it's actually interesting because we can modulate so many different things. The spot size, we can modulate the distance that the dots are apart, like the density of the dots. We're also able to modulate the entire energy, like how much energy is delivered at one time. So this is just an example here of if we wanted to go down on the setting a little bit by making it more fractionated. In other words, we want the dots to be less dense. So this is an example of that. Let me show everybody here. Here we go. 1, 2, 3. As you can see, if you look carefully, these dots are actually more tightly packed than these dots. And even more so, I can go again, and this is even less dense. So here we go. 1, 2, 3. And those dots are even less densely packed. It's really an art form to lasering, and so we're able to do that with this particular laser, and it creates a really, really beautiful, smooth contour for the patient. CO2 laser has an unbelievable amount of energy, so we can actually even use the CO2 laser to actually cut skin during surgery. And just to give you an example of how powerful it is, I'm also going to demonstrate on my trusty tongue depressor. So let me show you this. This is pretty wild. So we're going to go right now. I'm going to put it on the actual the point mode here, and here we go. So that's another setting on the laser, and it's created that. And as you can see, it went right through it. So really, really powerful. Obviously, we would only use that for surgical procedures, but this laser has an unbelievable amount of potential and also very, very powerful. So you want to make sure if you ever have laser procedures done, that it's not a minor procedure. It's something that should be taken seriously, of course, and you want to make sure that who's ever doing it knows what they're doing, because there's potential to do some amazing things, but only in the proper hands. Yeah, the new skin that's left behind is fantastic. It looks fantastic, and it looks really rejuvenated. It's awful. It looks good because it looks good. You know what I mean?
Yeah.
It's great. It's great because it's great. That's really what we're going for here. The greatness. I think that's really the most the most important.